Now we'll look at the larger issue of inflammation and its impact. Inflammation marks an immune and healing response in the body. The body is sending more blood and white blood cells to the area to heal. Inflammation can be characterized by redness, soreness, pain, heat, and swelling. Itis denotes inflammation. When you see itis tacked onto a word, it is denoting an immune response. Osteoarthritis, ortho equals bone, joint inflammation due to wear and tear. Rheumatoid arthritis, joint inflammation due to immune response. Tendonitis, tendon inflammation. Ligamentitis, ligament inflammation. Bursitis, bursa inflammation. Acute inflammation at time of injury is a normal healing response. Chronic inflammation can lead to problems. The picture shows an inflammatory response in the feet due to chilblains, which is the response to extreme temperatures. Let's look at inflammation and tendonitis. Tendons can become aggravated from overuse. Here is an example of tendonitis of the elbow. Tennis elbow and golfer's elbow are tendonitis of the common extensor and flexor tendons of the wrist, respectively. They are usually repetitive stress injuries. Although you cannot see the inflammation from the outside, the tendon at the elbow feels sore and may make some movements uncomfortable. We can also look at inflammation and arthritis. This photo shows an example of arthritis, the swelling of the joints. Osteoarthritis is most common, and it can be found in any joint. It's also caused by the wear and tear of overuse, and the common in older practitioners. Rheumatoid arthritis is caused by a dysfunctional autoimmune response in which the body starts attacking its own tissues. In lupus, this is where collagen disorder that can present with severe arthritis. All of these conditions may make weight bearing on hands and wrists painful. Here we see inflammation and bursitis. Bursitis is inflammation of bursa, small fluid-filled sacs that aid in movement. This graphic shows inflammation of the bursa at the elbow. The picture here you see is somebody who has gout. And this is the inflammation caused by a deposit of uric acid crystals into the joint. So inflammation in general. What may be some good common sense suggestions for a student working with inflammation of any kind? We want to avoid increasing the pain levels while facilitating gentle mobility to encourage circulation. A common example of tendonitis in the wrist is carpal tunnel syndrome. In the case of carpal tunnel syndrome, inflammation of tendons impinge median nerve, which causes numbness and tingling. Often, it is a repetitive stress injury. Repetition of an action aggravates the tendon over time. The tendon sheaths in the carpal tunnel are inflamed and impinge upon the median nerve, leading to pain in the wrist and hands. Carpal tunnel, or CT. What common sense modifications would you offer someone with carpal tunnel, or CT? You would use muscular energy in the hands to keep pressure off the wrists. We would keep the weight in all four corners of the hands and knuckles. We can use props to support the heel of the hand to take the weight off the joint and bring pressure more to the fingers. You can weight bear on the fists rather than the palms to keep the wrists neutral. You can also have students work on their knuckles to remove wrist flexion, and you could have students work in similar poses but in a non-hand weight-bearing way.